Hi everybody, it's Stacy Hagan from Simulation. I just wanted to go over some information with you to get you ready for simulation next week. So I'm just going to review expectations, what you're going to do for prep work, what post work will look like, things along those lines. So this will be part of your virtual simulation orientation. When you've completed, when you're finished watching this video, make sure you complete the rest of the module and watch the videos on the mannequins that we will be using during simulation, so you're a little bit familiar with them before the day of. So I just want to start by saying, remember that in simulation we follow Vegas rules, and what that means is what happens in sim stays in sim. And the reason for that is we want to keep what happens in simulation confidential to protect your privacy, but also to protect the integrity of the simulation. When you share information about what happens in simulation, you basically rob your fellow students of learning experiences. So please do not share what your simulation experience is outside of the simulation. You know, if there are feelings to unpack or thoughts about the day, that will take place during the debriefing period, which will happen at the end of our simulation day. So with that being said, your simulation is part of your clinical experience, so the same rules for clinical apply to simulation, meaning all of your work that you have to complete for sim is required work, so you have to do the work. You do have just one sim day during this semester, and that is next Tuesday on March 1st. You will come in at 8:30. It will be from 8:30 to 15:30. You will start off the day with your med math exam, so please do your best to be on time. Wouldn't hurt to be a couple minutes early just so you can, in case you're having any issues with Canvas, which that can happen sometimes, but just get there, make sure you're there on time. If you can make it a few minutes early, that would be greatly appreciated. With simulation, we have the same expectations of professionalism and work as we would expect in clinical. So when you come to simulation, treat it the same way you would treat coming to clinical. In terms of mindset for sim, we like to keep it positive. And basically, you're working as a team in your simulation. We want you to be supportive of each other. We also ask that you don't pretend in sim, which seems kind of, funny that we're asking you not to pretend when you're pretending this mannequin is a real live patient. But what we mean by that is if you find mistakes while you're caring for your patient, such as the wrong med or the wrong route for the medication at hand, go through the steps that you would go through in real life, in the clinical setting. Don't, if you have a PO med and it's an IM form, don't just pretend and go along. Or if you're trying to scan your med and it's not matching, don't just bypass that safety protocol and give the med anyway. So go through the steps that you would go through in the clinical setting. And another thing, just like with test out, we want you to use your safeties. I know that's a little different than lab, because lab you're reusing your stuff from your kit, but make sure that if you're giving an injection that you engage the safety and you dispose of it in the appropriate sharps containers, and there's one in each simulation room. So in terms of work, you do have some prep work that will be due. You can find that in your Canvas course shell for clinical, that NPN 171. If you look under assignments, you will find an assignment for prep work. Prep work is due prior to coming to simulation. It's required to submit it electronically. You're welcome and actually encouraged to print it out and bring it with you, but it must be submitted electronically through Canvas before you come to simulation. And no handwritten work is accepted. So please don't handwrite it and take a picture and post it, because you will get a 0 for that. Please make sure you're typing out your work and submitting it in Canvas on time. So you will have that coursework. For prep work, no late work is accepted. So what that means is, for you, is if you don't submit it on time, you get a 0, but then you still have to do the work because all the work is required. So it is in your best interest to do the work on time so you can get your points, because you still have to do the work, but if it's late, you don't get points for it. So that's the prep work. For post work, you will be completing a reflective journal, and that is also in your course shell under assignments. That will be due at 1600 on the Monday after simulation. However, I would encourage you that if you have the time after sim on Tuesday, you go ahead and complete that. And the reason I say to do that is because then the day is fresh in your mind. You will get through that assignment so much faster, and then it's done and you won't forget about it and don't have to worry about it. That one you can turn in late. The late points system, probably that you're accustomed to in lab, is going to be applied to sim as well. So you can refer to the rubric on that assignment to see how many points you lose per day. After 7 days, it's a 0. But do your best to complete the work when it's due so you can earn all of your points. What else do I want to say? So, in simulation, we do expect you to act professionally, be respectful of each other, yourself, and the faculty. We want you to treat your sim lab and clinical experiences as you would a job interview. So be, at the top of your game. Dress code is the same for clinical. So you're going to wear your clinical uniform to simulation. And that includes also a stethoscope, a pen, a watch that you can count seconds on. So all of that is part of your uniform. We just request that. So, and let me back up a little bit. Make sure you bring something to write with and on for report. Now, having said that, we do want you to leave any book bags, purses, drinks, etc. in lockers. We don't want that in the virtual hospital. So make sure that you bring a lock if you're bringing something valuable, but it's not going to be allowed in the virtual hospital. We have several different resources, types of technology in each room. If you remember from being in there before, there's a telephone in each room. We use the Learning Space software to kind of watch through those cameras in the ceiling and in the wall. We have a call light system. There's a head wall that has oxygen and suction on it. There should be a laptop in every room with a scanner. There are gloves in every room and alcohol for hand hygiene. Remember that there are supply cabinets that should have everything that you need to perform in simulation. If you find that there's not something there that you need, again, go through the same steps you would go through in the clinical setting to try to take care of that. The mannequins all have a gingerbread man on the posted on the outside of the room that they're in, and that will have basically what the mannequin can and cannot do. So it's a good idea when you get in, first, make sure you watch the videos, but then the day of sim, go ahead and review that just so it's fresh in your mind when you get started, so you know which mannequins you can give injections to, which ones you have to use the injection pad on the table, which ones you can check pupils, and which ones we will have to give you the information on. Another thing that I want to cover is, roles are assigned in simulation. They are not strict. We always encourage you to help each other out, but at the same time, we don't want one person running the show in there. So give your peers a chance to troubleshoot and figure things out on their own, but if they look like they're struggling and they can use some help, go ahead and offer, because we do expect you to work as a team in there. So just to kind of orient you to the day of, we will start with the med-math exam. Then we will go to pre-conference. You'll have pre-conference that will be about a half hour long. Then you will come upstairs to simulation, and we will go through the pre-brief. And what the pre-brief includes is bedside report on your patient. We will use the SBAR format for that. And that's when it can be helpful to have that prep work, so you can kind of see whatever that disease process is for the day, things that can be helpful for you in performing the tasks that you need to, or maybe the patient teaching that you need to for that simulation. Then we will run the simulation. Simulations are normally run about 30 minutes. We will stop you at the end of the simulation, and then we will go to debriefing. Debriefing, basically we just come in and kind of unpack all those feelings that we're having from that simulation experience, and then we have discussions about things that went well during simulation and things that could have gone differently. And just a reminder that this is a time to be respectful. We're all there. The whole purpose of simulation is to improve, to become safer, more knowledgeable, more proficient nurses. So we want to be supportive of one another, but also we want to be able to reflect on our actions that day and our thought processes, and look for those weaknesses and places that we can improve. So that is simulation in a nutshell. If you have any questions, you can reach out via email or just ask the morning of. We can take a few minutes to answer any questions that you have about the day. But now this is the end of this video. Hallelujah, only 12 minutes long. Then the rest of the videos will be fairly short. They should be under 5 minutes. So there should be 3 videos left for you to do. So make sure you complete the orientation, because it is mandatory to have that completed before you come to simulation. So thank you for watching, and I'll see you next week. Bye.